you have to look at this 50 million that is being taken from the taxpayer purse, right? This is our money, right? It's taxpayer money that's being shifted out to private corporations, right? And yet all of these costs in myriad ways will still be borne by the public system. So David Bailey comes the closest with his honesty to telling you what's really going on, because he's telling you we could have, over the past year, have done a bunch of these surgeries within the public system using public theater and public staff. But we were told that the public system couldn't afford to hire the theater nurses to run theaters on those days. I think they do like weekend clinics, like Saturday cases, to catch up on the lists. So they were told, sorry, we can't do that. And then he looked and he said, well, but you're sending these really simple cases, these easy ones down to Auckland, again, for premium rates. We could have done those locally at much less expense. And, therein lies the awfulness of all of this, is that we could have done it within the public system, but the decision was made. It is better to send that 50 million out there into the private sector. Now, again, it gets worse, because the surgeons and anesthetists that are doing these cases are the same ones that work in public by and large. Now, there are some that don't exclusively work in private. That's not that common. Most split. And so what do you think happens when you have easier cases for higher profit in the public sector and resources being diverted there? So, this is 50 million that will not go to making another operating theater at the local hospital. It's 50 million that will not go to hiring nurses at the public hospital. This money is gone. And so for the person who says like, oh, this is a great thing, I got done quicker, you have to realize it is leading to the crumbling of the public healthcare sector and to your local hospital and to your staff. Surgeons and other proceduralists and anesthetists will follow the funding where it goes. And so if they can have easier cases for higher rates in private, they will do more cases in private. And, Simeon was asked about that, and he said something like, we've got good people on it, and they're working to ensure it doesn't happen. That's just hot air. That's just words, idle words. The surgeons will leave the public sphere and go to private, just like they have in radiology with all these private imaging centers that are, again, like sort of stealing our public doctors, and they won't come back. It's a sticky thing. If the money's out there and the privates are now getting 50 million, what are they going to do with it? Some of it is they're going to get the CT scanner that we needed. They're going to get the MRI to replace our overworked, aged one. Kaitaia Hospital begging for a CT for a decade. Well, the private imaging centers in town each have them. In some cases, several advanced imaging modalities, CTs, MRIs, PET scans, what you name that sort of thing. It exists in the private sector to the exclusion of the public. And so I want people to understand that private is not private. Almost all of its money is siphoned from the public healthcare sector. Let's just be honest and clear about that. It's not rich people, paying their insurance and getting care. To a huge extent, it is the diversion of taxpayer money into the private sector to great benefit of the corporate owners of those entities.